Ann Matthews, an infection control nurse in Atlanta, Georgia, is faced by a critical dilemma. 3 patients in a hospital have all contracted post-procedural bacterial septicemia. It's just a fancy word to say there is bacteria in blood. All 3 have a fever and dangerously low blood pressure. But here is the twist. All 3 patients are in separate areas of the hospital in different units and all have undergone different procedures. How did 3 people in different areas of the hospital get the same infection? Did they meet each other? Absolutely not. Or did they have common factors like operated by the same doctor, were same surgical or non-surgical equipments used, met an infection carrier? Turns out all 3 were operated by different doctors, so that's ruled out. And none met a common carrier. So did they contract infection from any equipments used in the healthcare settings? Before that, let's get to know something about these people. The first patient, Joseph, a 37-year-old construction worker, is recovering from rotator cuff surgery. He is in relatively good health otherwise. Second patient, Jessica, a 16-year-old student in intensive care, is in critical condition following an automobile accident. The third patient, Maria, a 52-year young woman, is recovering from coronary artery bypass surgery. As far as Anne can tell, the only thing common between them is the infection itself. The causative agent of this infection is Klebsiella pneumoniae. It's a gram-negative bacteria, inferring that it could be part of normal intestinal microbiota. Microbiologists consider this as an opportunistic pathogen, meaning it's harmless until your immunity is relatively strong enough. In other words, it strikes you when you're down, and when it does, it gets real bad, and it causes about 8% of all healthcare-associated infections. Now here is another question for you. Might have to use your reasoning skills and knowledge in advanced medical pathology of gut microbiota? Well, primarily just your reasoning skills, of course. Who among the previously mentioned 3 people is more likely to face health complications due to this infection? Who do you think it will be? But before that, let me tell you, although the other 2 patients are recovering soon and well enough, the one patient's condition is getting worse even though they were all treated with the same medication, like having a fever and dangerously low blood pressure. All 3 are administered with the same antibiotic, imipenem. The patient we are talking about is Jessica, the most unlikely one, isn't she? It's quite evident that the antibiotic is killing the bacteria. Then why are the symptoms like fever and low blood pressure is still worsening? Like a dead snake's venom still active enough to kill the toxin on the bacterial outer membrane, lipid A is still left unneutralized, causing fever and capillary dilation. In other words, low blood pressure. But finally, they change the medication by giving her the antibiotic polymyxin, to which the person responds favorably. Why didn't they use it in the first place? If they had, we wouldn't be having this story. Just kidding. So now let's see how did these people get the infection. Anne was sitting beside Jessica when she notices a patient being fed with ice chips by a relative. On a hunch, she hurries back to office to find out whether the ice machines were swabbed. They were not. She immediately orders the machines to be swabbed and cultured. Her hunch turns out to be correct. The samples are positive for the bacteria which grew in hospital's water pipe, entering the ice machines with incoming water. Glycocalyx is a compound which enables the bacteria to stick to the water pipes, forming a slimy layer. The disinfectant was inadequate. A few of them got dislodged by the flowing water, which will infect a weakened host. Hope you like the video. We'll be coming up with some more minutes of science. Until then, bye bye. Take care.